Namaste, good evening. On behalf of IIT, I'd like to welcome you on this Facebook page and YouTube channel. It's a emergency that many people have, due to COVID, many people need some assistance. And they keep calling IIT for help. They are calling various people. So we thought of coming live with a very important person. We have a doctor with us, and we have an IIT youth chairperson, Nikon Sachdev. I like to call him on a screen. Nikonji, Sat Shri
Good
Akal.
evening, everyone. Sat Shri Akal ji. Good evening, everyone. And a
Good
very,
evening.
very good thank you for Uncle Papni to arrange this IIT helpline conference, a live video in this pandemic times to inform all our Indian community of what's going on with the COVID-19 virus. I know that right now, our Indian community has really been affected by the COVID-19 virus, not only in terms of businesses and in terms of the financial status, but at the moment the virus is hitting home. A lot of us are affected and infected as well. We started a program 2-3 days ago with the cooperation of all the communities in Bangkok, as well as with the cooperation of a few firms such as FICO or Golden Tulip and Movenpick and all, who are helping us procure hospital beds or hotel beds which have been converted to hospitals. In the past few days, after we've started this program, the person who's helping me, Miss Anjali, and myself, we've received a lot of phone calls, and these phone calls have been from our Indian community, mainly from the community that we are living in, and it's affected close to home already. People are in a state where they don't know what to do and how to help themselves in this time. They don't know who to contact for medicines or who to go to, which hospital to contact, and we are helping them out. Our Indian community is very generous, and I would like to thank all of you from the bottom of my heart. Thank you so much in sending us goodwill and as well as support of funds to help all those people who cannot afford a treatment at this time. So this is what the current situation is about, Uncle Papni or
Yes,
Uncle Chuan.
well, don't Uncle Chuan or Uncle Papni, it's okay, no problem. All right, so now we have a Dr. Nan. Without talking further, we come to the topic. Today's topic is the home isolation and home antigen test. Plus, you must be having few questions, and then let's welcome Dr. Kanchana to screen.
Hello, everyone. Good evening. Sat Shri Akal to all.
Sat Shri Akal.
Sat Shri Akal ji. Good evening, doctor.
Okay, Dr. Kanchana, she used to practice in a police general hospital as a general practitioner. Now she's doing her private. Yeah. So Nikonji, go ahead with the question and answers you have.
Good evening, doctor.
Good evening.
Thank you so much for coming at such short notice. But at this time, we were left with so many questions that we could not answer, and we needed some professional help. That's why we contacted you. And thank you so much. Doctor, my first question to you from the people is that, what are the symptoms of COVID?
Mm-hmm. Basically,
Can you please explain?
If you ask what are the symptoms of COVID, I would say that some people can even basically have no symptoms at all. Or if you're talking about symptoms, then they can be fever, cough, runny nose, common cold symptoms, or sore throat. But one of the specific symptoms of COVID that we've seen so far is the no sense of smell and no taste, that they lose the taste and they lose the sense of smell. So like basic smell, like sometimes the smell of coffee or sometimes taste of sour food is lost. And we have also seen cases of reported of red eyes, and diarrhea. So basically, the symptoms is quite wide. It can range from just common cold to severe symptoms, difficulty breathing. Yeah.
So if a person is having a little sore throat, or
Mhm.
getting up in the morning and just a little a little bulgum in the throat or something, can it be considered a symptom as well?
Basically, if just wake up with a little sore throat or something, sometimes people can over worry. But I think it's better to be more concerned than not at all worry about it. So I think first you will have to see if you have a history of exposure, if you're exposed to someone who is at risk or not. I think you should not over panic. Like if you have basic sore throat, it could be nothing or it could be COVID symptom.
All right. Doctor,
Yeah.
just now you just said exposed to someone at risk. Can you
Yeah.
please elaborate a little on that, please?
By exposed to someone at risk, basically we divide like if you are high risk or low risk. If you have somebody like let's say your first cousin or somebody who is living in the same family is COVID positive.
All right.
They just tested positive a few days ago, but you were with them yes just yesterday like that. Then you're considered high risk. But if you met them like around 2 weeks back, then you are at considered a low risk. Or if your driver is positive, that is considered high risk. So someone who you are in close contact with every day and they are positive for COVID, then you are considered high risk.
Okay. Uncle Papni, do you have any questions about symptoms for COVID?
Yeah, many people are calling and they are totally panicked. So, number one, they want to have medicines, immediate medicines, what they should
Uh-huh.
take.
I think the immediate medication that I would suggest that everyone should have at home, or even those who are home isolating should have during this COVID pandemic, basic is paracetamol.
On Facebook.
Okay, they should have paracetamol and some dry cough medication like dextromethorphan, or even cough with sputum medication like Naclong. Do you want me to tell the doses as well?
Yeah, go ahead so that viewers can maybe note down or something. They can see
Yeah.
the program later on also.
Okay, so I would say paracetamol 500 milligram every 4 to 6 hours if you have fever or if you have body pain. First, that is the most important one. Then, for cough, if you have dry cough, then dextromethorphan 3 times a day, morning, afternoon, evening. But if your
Mhm.
cough is with sputum, then you should have Naclong. That is a medication that dissolve in water, just 1 time a day. And what else I would suggest to have at home is a thermometer and pulse oximeter to measure your oxygen. This is what everyone must have at home.
Okay, what is the oxygen level should be?
Normal oxygen level, usually if you're healthy, it should be around 99 to 100%. But
Hmm.
if you are starting to be at risk or having difficulty breathing, we would consider a level less than 96 a concern. If your oxygen is less than 96, even when you speak, you're already tired.
Hmm.
And
So that you will need oxygen.
Okay, what people are talking now in Thailand that this Pha Thalai zone, how
Yeah.
much is that essential or it's just a
is it a
ordinary
myth?
medicine?
Yeah.
Yeah,
Is it
it's
a
not
myth
a
or?
myth. There scientist studies have shown that there are some, it can be used, it has a treatment benefit. But people should be careful that you should have basically in fathalaichon, the medication that is important is andrographolite. That is the substance that is important in that. So you should, first thing I would say, if you're going to have, then you should have only the one that is FDA approved, and only if you have symptoms then you should take, because it does not prevent. It's only used for if you have basic symptoms, like if you're already having basic cough, starting with cough, you can have around, the recommended dose is around 180 milligrams per day for 5 days if you have symptoms, not more than 5 days.
Uh-huh.
Not more than 5 days.
Not
Okay.
at all
So
more than
you're
5 days.
saying symptoms, but if I say that is there anything, I don't have symptoms now, can I do anything to prevent myself from getting COVID? Any preventions that I can take besides
The,
staying home and staying safe?
the best thing you can do to prevent from COVID is basically, I would say, wear double layer mask. It helps a lot. And alcohol, because there's no other way that you can prevent getting the disease. Stay home, wear double mask, you wash your hand frequently. I know it sounds like basically nothing, but it helps a lot.
Okay.
Okay. And
there,
how about
there's
the
no there's no medication that you can have to prevent getting it. If that's what you're asking, there's no.
okay, another thing I want to ask, like in India, people they say take the steam. How
Yeah.
essential steam is during COVID for the
Steam.
COVID patient?
Basically, the steaming helps with easy breathing. Like those who are
Mhm.
having cough with sputum or having a little difficulty breathing, steam isolation just help relieve that symptoms.
So how much steam should be taken? Like many people, they have a myth. They say if they take continuous steam, 2 to 3 hours continuous, they're taking in a little interval. And there is a black fungus which hit in India.
Yeah.
So, so I've been requesting. Means people are requesting, asking about this one also. So, what do you have? What you can say about that?
The about the steaming, the duration I think is not recommended more than 15 to 20 minutes per time. The long
Okay,
hours doesn't help. It does not increase the benefit of steaming.
okay.
Yeah.
Yes, Nikon.
One more thing. I just got a question on my WhatsApp. Is
Okay.
that people are saying to have turmeric with honey and ginger every night before sleeping to prevent infections.
Right.
What is your take on this, doctor?
I think there's no yeah, there's no proper scientific on this if it's work or if it doesn't work. But I know that turmeric honey helps with symptoms of cough and basic cold. Yeah.
Okay.
So if you're taking for preventing of cold and cough, a little amount a day doesn't hurt anyone. But I cannot say that it will prevent from COVID. The best prevention is, like I said, stay home, wear double mask if you go out, and wash your hand with alcohol frequently.
All right.
What do you say
Uh,
about hot water and cold water? Many people they have this one during COVID. They should not take cold water.
The best thing I would recommend is room temperature, not hot, not cold, but room temperature.
Okay.
all right.
There.
I've got another question now. Can you
Yeah.
please clarify this? That many Indians are insisting that Indian doctors are prescribing antibiotics, even though we tell them that it's viral, not bacterial. What
Mm-hmm.
should we do?
I think this is a very common issue that we are seeing right now, that people are over prescribing antibiotic. As I said, antibiotic is only for bacterial infection. It's not for viral infection. It does not help. In fact, if you take antibiotic for a viral infection, it will decrease the good bacteria in your body and make you more susceptible to infection.
All right.
Yeah, so I think if you should not buy, like in Thailand it's very easy to go out and buy antibiotics for yourself, basic augmentin and all. I would suggest that if you're not tested in the hospital or have a lab report saying that you have a bacterial infection, you should not take antibiotic at home. Yeah.
Sounds fair enough. Uncle
Okay.
Papni and
Yeah.
Dr. Kanchana, Dr. Nan,
Yeah.
we have a lot of cases that have been coming in where they have actually gone to the hospitals
Mm-hmm.
feeling that they've got COVID, but they're okay, but they have fever or low fever or something, and hospitals are refusing to treat them or to test them. Sorry, not treat them, to
Yeah.
test them, to test them. So, what should a person do in this in this case?
See, right now, basically, the way that hospital are screening is they're only testing you if you're actually at high risk, and the tests that are usually done in hospital is the accurate lab test, that is RT-PCR. But the one that now that we can do, that we can know by ourselves, is basically rapid antigen test that can be done at home itself. So there's a kit that you can buy around, I think around 400 baht.
Okay, there
And
are lots of antigen tests, right?
yeah, this is a rapid antigen test.
But there are many in the market, and many they say they are not Thai FDA approved. So they must
I
check
think
this one, or all they okay.
I think there are a few that are FDA approved, but even if you do a test, it's a rapid antigen test, and you're tested positive, then you go to your local hospital with that test. They will ask for your history if you're high risk or anything. Then they will test you for the confirmed lab test. So basically, the rapid antigen test is just a screening test because the amount of people getting COVID-19 today is quite a lot that they cannot test in one day. So I would suggest if you feel that you're at high risk, I think you should do a rapid antigen test at home first.
Okay, is there any particular way of doing this test? Because many people they do it and they say it's negative at home, but when they go to the
Uh-huh.
lab, it's a positive. I think they
Okay.
must be making some mistake. They are
Right.
not inserting enough inside
Yes.
because
So
of
the first,
fear of hurt.
yeah, the first thing I would say about this test is the basic rapid antigen test is just a screening test. So sometimes it's not 100% positive, but there's a technique to do it as well. The nasal swab that they have is quite long. So some people are not inserting it deep enough. If you see the swab, there's a marking on the swab, there's a red line. You're supposed to take the depth till that deep, till the red line. Because sometimes the virus in your nose is very little. And if you go deep till the nose and throat, if you reach the red mark, it will be almost to your throat. So there's a quite amount of virus that you can get. So that's why if people are inserting not deep enough, sometimes your test is negative. So I would tell the basic way to do is you take a nasal swab, insert till the red line and turn it around 3 to 5 times. Then you take it out, then put it in the antigen solution test, turn it around 2 to 3 times, then drop it on the test, 3 4 drops, and wait for 30 minutes. If you see two lines, the line that is if there comes two line, that means it's positive. If it's just one line, then you're negative for COVID.
So there are two lines, right? Either
Yeah.
bottom line or top line. Either line
See,
or only top
no,
line.
the first thing that will come up positive is the first line is the C. The C represents control, and the second line is the letter T that represents test. So if
Mhm.
it will be, you will see one line for sure on the control. But if
Yeah.
after 30 minutes it comes up two line, both on the control and on the test. Basically, if both line is on C and T, that means you're positive.
Okay.
Yeah.
Staying
But
on this
if
matter,
another scenario, if there's no
Andy.
line at all on your test, no
Hmm.
line at all, that means that test is faulty. You have to repeat the test again.
Okay. Staying on the same topic,
Yeah.
Kungita has asked a question that what about the blood test in home kits? What do we
See,
do with the blood test?
no, the blood test is not for testing COVID. It's for testing if you have antibodies against COVID. So basically, if you have already been exposed to COVID, your body will start making antibodies to fight the infection. Or if you have been vaccinated, you will have antibodies for COVID. So the test that use blood is not for testing if you have COVID or if you don't have COVID. It's testing if you have protective antibodies for COVID.
All
Mhm.
right.
Yeah.
Wow. Today,
But
Dr. Nan is really answering a lot of questions that a lot of people have in their mind that
yeah.
they didn't know what is going on. You
Right.
know, they were all just following YouTube channels and things, but this is really we're not ended here, but
Uh-huh.
I'm really, really, really pleased that we really got Dr. Kanchana to come on the IT. Mr. Chuan, very,
Yes.
very good job.
Dr.
I'm happy
Kanchana.
to give any information I
Yeah,
can.
Dr. Kanchan, yeah. Now there are some few questions also. So one of
Yeah.
them I now it came in my mind to ask you because
Okay.
people are asking me and asking. They are not doctors, so we cannot give them advice or something. So it's better
Yeah.
since you are online. So I better ask their question from you, since
Okay.
many people are got vaccinated. Okay,
Okay.
some got Sinopharm, some got AstraZeneca, something, right? Those one.
Mm-hmm.
So many people they have this question: can we go for different company dose? Like those who
Mm-hmm.
got AstraZeneca, they want to go for Moderna, and those who have a Sinopharm, they want to do it for another one. So, what do you recommend on that one?
See, first, the first thing I would have to ask you is if they want to change dose. That means you're asking me if the first and second the dose, the first and second injection. I would recommend that, according to WHO, you should not mix vaccine for the first two injection. But if you're
Uh-huh.
considering the third dose as a booster dose, so I would give you a scenario basically. If in Thailand now, mostly people are getting uh, inactivated vaccine, that is Sinovac and Sinopharm. So I would suggest you get Sinovac 2 dose. If you've already got Sinovac 2 dose, then you wait for a booster dose to be AstraZeneca, that is a live vaccine. Or if you're asking which is better right now, if you can, then mRNA like Pfizer and Moderna, that is the best option as a booster dose. As in Thailand, we do not have option to go straight for the mRNA vaccine. So I would not suggest to go for first vaccine as Sinovac and then second vaccine as AstraZeneca, or first vaccine as AstraZeneca, second as Moderna. WHO doesn't recommend that.
Okay, but
All right.
a question has just come up that
Yeah.
if
Mhm.
a person has had 2 doses of Sinovac, the
Uh-huh.
third dose, can they take an Astra or Pfizer or Moderna?
It can be either. But if you're asking if you have an option, then go for Pfizer or Moderna, or even Novavax. That is coming up. And right now, Novavax is considered the best. It's a
Okay.
protein subunit vaccine, but it's not available yet in Thailand.
Okay. There's another question came on a screen. Please
Mm-hmm.
advise medication for the kids or young children.
Okay. So basically, medication for preventive, that I think is for same, not preventive, basic symptoms. It's the same. Paracetamol and medicine for dry cough and for cough with sputum. But there's no medication to prevent for COVID, like I said. Sadly, we have not reached that level yet.
Okay. We've come to
I would
this
like to
one.
stress upon one thing. Right now,
Yes.
all I think best that everyone can do is to have basically to have thermometer and pulse oximeter at home. That is, I must stress upon that. That is very important because that's
All
how
right.
you can measure your symptoms. You can measure your condition if it's worsening.
All right. So after getting tested, if a
Hmm.
person finds out that they are positive, but at the moment, as you know as well, that
Yeah,
hotel beds are very, very hard to get at the moment. How
right.
can I isolate myself at home? This is the main question.
Okay. So basically, there's a checklist that if you have to isolate yourself at home, the first thing is you have to be either asymptomatic or with very less symptoms, or you're supposed to be less than 60 years old, and you're in a healthy condition. You don't have the severe disease like kidney disease or a heart condition or have previous history of stroke or uncontrolled diabetes. And at home, you should be able to have a separate room to isolate yourself from others, and you're not allowed you should not use the same utensils as others, either separate utensils or use a plastic utensils for throwing for each time use, and always wear mask if you're going to be coming out to get food from somebody. Yeah.
Okay, doctor, there's a question
And you
on
have
the.
to test your body temperature 2 times a day, oxygen 2 times a day.
Okay, there's a
Uh,
question on a screen. Geeta has asked, any idea on what kind of vaccine should be opt for the pregnant woman?
Right now, that based on recommendation is for pregnant women, they would recommend either Sinovac or Sinopharm. In some
Mhm.
cases, they are giving AstraZeneca, but for safety concern, I would say go for dead vaccines like Sinovac or Sinopharm.
Okay, now there's another question from Ranju Sadatna. Doctor, please
Okay.
tell us about vitamin C and zinc.
Okay, so vitamin C is the one that have shown to have a lot of common cold preventive effect, and that is the dose of 100 milligrams per 1,000 milligrams per day. If you take vitamin C with a little amount of zinc, I think there is vitamin C that is available that has zinc mix in it. Uh, Around 1,000 milligrams a day, one tablet. I think that is just prevention for common cold. But it has nothing to do with COVID, but just to prevent yourself from common cold.
Okay, there's
All right.
a
There's another question over here. What is the dose to be taken for andrographis paniculata?
Okay.
Doctor, do we have?
Andrographolide, right? That is the same as the substance in fathalidone. That
Okay.
is, like I said, if you have COVID, that is 180 milligrams per day for
180
5 days.
milligrams.
Yeah, for
Does
five
it
days, not
does it
more than
does
five
it
days.
does it is it different for people with different weights, or is it a
No,
basic?
no. The recommended dosage is 180 milligrams. But if you are
okay.
severe overweight, then only that you have to be consider. You have to consult with your doctor.
Okay, there's a question on a screen. What
Yeah.
happens when someone gets vaccinated not knowing if they got COVID positive?
If you do not know if you are COVID positive, basically before you get vaccinated, there's questionnaire to answer. Like if you have basic symptoms like fever, sore throat, runny nose, any symptoms that could be of COVID, they will ask you that first. But if you already injected, if you don't have those symptoms, then they would inject the vaccine for you. But if you're at
Okay,
risk, then you wouldn't get the vaccine.
okay.
You would
There's
be
another
tested
question
first.
from Mr. Kotari. And
Mm-hmm.
what mg of zinc with 100 mg vitamin C?
I'm not sure about the proper dosage of zinc with vitamin C. Let me just check on that for you.
All right. While you're checking that, Dr. Nan, the Thai
Yeah.
government at the moment has
Mm-hmm.
mandated that they've changed that first dose be Sinovac and second dose be Astra. Is that
No.
okay? Is it safe? Or how should people do it?
If you ask me if it's safe, I would base on WHO. And
All
WHO
right.
does not recommend mixing the vaccine yet because right now we do not even have enough study of not mixing vaccine. Just one vaccine. Usually for a vaccine to come out, it takes around 3 to 5 years minimum for studying the efficacy and the side effects of each vaccine. And right now we are just mixing vaccine, not knowing the side effects of it. So the WHO has based that do not mix your vaccine yet. Yeah. So I would
Okay,
All right.
say don't mix the vaccine because
okay.
we've
There's a one
seen
question.
cases reported
Mm.
that a person has got the first dose of Sinovac and second dose AstraZeneca, and I'm sorry to say that they didn't make it. Yeah.
Okay, somebody asked home test kits are reliable blood test.
I think it's around 85 to 90% effective. So I would suggest that there's no harm in trying in getting it tested first.
Okay, again,
And
Geeta, when
no,
should you consider
Kun
going
Geeta
to
has got the
doctor?
question that actually, which is on the panel list also,
Mm-hmm.
Mr. Chuan. Kun Geeta has got the question that when should you ask help for a hospital bed or hotel bed? So indirectly, when should you really contact our group or our Indian community group that please, we are in a dire state and we need help? When should that be done?
Okay, like I said, first thing you need to do is if you already are tested, if you're tested positive, you're home isolating at home, you measure your body temperature with the thermometer. If more than 37.5, that means you have fever. And if you have 38 temperature, that is high fever, and you take Tylenol and it's not coming down, you need to take 4 to 6 hours, and you notice that your oxygen level is dropping. There's one thing that you can do that I would suggest is, it's called a 6 minutes oxygen test. If you just measure your test at home oxygen, if you just measure the oxygen with pulse oximeter, sometimes the reading at rest is not that accurate. So right now, the thing that the scientists are saying is, if you just walk around, if you're not old people, if you're like 40, 50 or something like that, walk around in your house for 6 minutes, then you measure your oxygen level. But if you're 60 above, then walk for 3 minutes and measure your oxygen level. If it's less than 96 and you also have high fever, or either or, you have high fever or low oxygen, contact the hospital immediately because you will need oxygen.
All right. Now with this one, now we already had lots of question in this thing. It's already half an hour, and we requested doctor for 15 minutes, but it already took half an hour, and,
No
and it was
problem.
really valuable and informative. Whatever you give the information, viewers definitely must have benefited from this one. If viewers have more questions, they can write down to us on this Facebook, and definitely we're going to come back again with the next live show. Okay,
Sure.
Nikonj, you have
Thank you so much. We have got again, Uncle Mr. Chuan, sorry, Mr. Chuan and Dr. Kanchana. Thank you so much for your time. Thank you, everyone. I've got a lot of calls in the past few days from people from many individual businesses and form foundations that they want to help our Indian community. Mr. Chan has also donated 100 oxygen measuring machines. Mr. Krit has also donated money. Mr. Pinder, Mr. Sarajit, Mr. Chuan, everyone is helping out. So if anyone wants to donate any medication, Mr. Jasbir Gulati, anyone who wants to donate any medication or anything, you can contact IIT and we can help disperse your donations to the right people through the right ways and help everyone out. Thank you so much. And thank you, Dr. Nan. Dr.
yeah.
Nan will be helping us doing a video call with some of the patients who are in critical states, who haven't got a hospital bed, but who are at home and they're worried at the moment. We, on behalf of IIT, will try to link her up with most of the patients to try to get them to know how to live in a safe environment at home with the COVID virus. Thank
Okay.
you so
Okay.
much,
So
Dr. Kanchana. Thank you,
thank you.
Mr. Chuan.
Just on a last note, I would say
Yeah.
this, whatever we touched upon today is just basic medication and basic health care and basic monitoring that one can do at home. But if your symptoms are getting severe or these medications are not covering, please contact hospital immediately. Yeah.
Okay, thank you very much. I just wanted to tell the viewers, vaccination, whatever you get first, just get the vaccination done.
Right.
Don't wait for, I want this one, I want that one. No, there's a rain. You don't have to see which umbrella you take the raincoat or umbrella. Just go there, protect yourself from this pandemic. Second
Definitely.
dose, third dose, we can decide later on also which one to take. Anyway, with this
All right.
one, we end this conversation,
One,
and thank you
one,
very
one
much.
last thing.
Yes.
Dr. Bakshi has asked one question, Uncle Mr. Chuan, before we end this session, is that if a person has giloy, aloe vera, and amla with hot water, does it
Mhm.
minimize risk of COVID? Is there any herbal medicine that someone can drink at home to minimize?
See, right now, if you're talking about herbal, the only one that have scientifically proven is andrographolide. There's no basic other studies on amla or anything else.
All right. Thank you so
Oh,
much.
Yeah.
okay. Good night.
Good
Take
Good
night.
care.
night.
Thank
Thank
you.
you.
Stay
Stay
safe.
Sat Sri
safe,
Akal ji,
everyone.
Stay healthy.
Sat Sri Akal ji.
Sat Sri Akal.
and God bless.